The National Primary Healthcare Development Agency has graduated fellows of the Oxford Policy Management Results Based Fellowship Program as technical assistants in health financing after undergoing a 10-month rigorous, not so easy training, excelling at tasks, written and practical assignments, internship programs. The agency engaged experienced and knowledgeable consultants from the Oxford Policy Management Nigeria team. The Executive Director of the National Primary Healthcare Development Agency, Dr. Faisal Shuaib, speaking through one of the directors in the agency, Dr. Oladimeji Olayinka, says the agency, in its quest to ensure healthcare delivery of the primary healthcare systems in Nigeria, it has incorporated the spirit of technical assistance in executing its core mandate of improving overall population health, both in quality and in quantity of healthcare service delivery. Hence, the graduation for the first time ever in Nigeria of indigenous technical assistants in results-based health financing.
14 persons went through rigorous selection process, 7 in service and 7 full-time fellows. The RBF-TA fellow structure used work-based approach whose curriculum was designed as an integration of formal learning and work-based activities. The aim is to develop the skills and knowledge of the fellows through technical, professional, and behavioral competencies. Hence, each of the formal learning block was followed by field practice under the tutorship of the RBF-TAs resident in the project states. Distinguished ladies and gentlemen, today we are here to celebrate the graduation of Nigerian nationals with technical, managerial, and behavioral competencies to serve as RBF-TAs for RBF projects in Nigeria as well as any part of the world. I am most delighted amongst you today, and I give glory to God for making this journey one of the successes achieved under my management. I sincerely thank the board, management, and all the staff of the agency for giving me the solid support, and I must not forget to appreciate the efforts and sacrifices made by OPM.
Participants were drawn from 3 states in Nigeria, which includes Adamawa, Ondo, and Nasarawa states.
Some of the key roles of the RBF-TA, CMBAs, and IVAs include: 1. Providing technical assistance to operationalize the RBF project at the National Primary Healthcare Development Agency and the states of Ondo, Nasarawa, and Adamawa. 2. Helping the states implement the project by designing and defining operational procedures for results-based financing, DFF, and DLIs, and building institutional capacity of the Nphcda and SPHcdas to carry out purchasing, verification, and oversight functions. Thirdly, assisting the states and the LGAs to make operational their DLIs and scorecard through an advisory function. And fourthly, to build the capacity of nationals while leading the separation of functions component. The RBF technical assistance has been concentrated for both NSHIP and the AF through highly competitive process, has been contracted for both the NSHIP and AF through highly competitive process. OPM was responsible for technical backstopping in the NSHIP states, while indigenous private firms have been contracted as contract management and verification agents and independent verification agents for the additional financing states. This is made possible through the lessons learned from OPM.
The Oxford Policy Management Nigeria consultants also advised that it will be beneficial and sustainable if the program is institutionalized in Nigeria, as it will increase capacity building in health financing going forward for a total coverage of population health.
Build the capacity, the competence, of 13 fellows, but as you know, the challenges of healthcare in Nigeria are huge. It's a big country, so there is a greater gap to be filled. And what we would hope is that a Nigerian institution, maybe an academic institution, will take up this program, both in terms of the objectives and the design and the delivery of that program, because it's just like I was saying earlier. Nigeria's reached a stage where it mustn't be importing too much. And certainly in this program, with the right institution, it can be self-sufficient. It can train more fellows.
We just ended the OPM Results Based Financing Fellowship program in Nigeria. We've just graduated for 13 fellows. It's the first of its kind that we have tried in the whole world. We are happy that it did go quite well for 10 months. We developed the program alongside the Nigerian government through the National Primary Healthcare Development Agency. We think that it would be wonderful for the Nigerian government to institutionalize this venture, look for a university setup that will host it, and then OPM could be providing technical assistance to the Nigerian government through that institution. It has to be an institution that is running a public health department that is also into healthcare financing project, so that we embed it into it, and we train many more Nigerians and many more international participants to have a fellowship for 10 months up to 1 year. It's a real novelty.
The National Program Officer, Hajia Binta Ismail, commented on plans the agency has to institutionalize the training of technical assistants in health financing, among other plans.
Okay, we're discussing with some institutions in the country to see how this can be part of the curriculum of health financing in the country. Also, the agency is looking at the leadership academy training. This course will also be one of the modules in the training, and that will also happen in the first quarter of next year.
One of the beneficiaries described the experience as special and first of its kind.
The thing that stands out is that this is the first of its kind. In over 40 countries that are implementing RBF, this is the first time. Secondly is that Nigeria is beginning to boost a lot of capacity to drive NSHIP. Globally now, this is the approach to go to get quality results for your $1, for your ₦1. And so we are believing that a program like this to enhance local capacity for Nigeria to be able to help us to improve our health service delivery is the way to go.
Certificates were presented to graduates who spent 10 months to emerge fellows of the Oxford Policy Management Nigeria RBF program.
We have Hassan Adamu Mohammed. We have Hiladira. We have 2 females in these are groups. Hiladira, thank you. And we have Ibiemi Monisade. She's coming with the 15th fellow. Let's appreciate her. Yes, this baby was born when we are running this program, and it's really a blessing.
Distinguished ladies and gentlemen, to the glory of God and for the development of mankind. I formally welcome these brand new fellows to the primary healthcare family as the first indigenous RBF fellows in Nigeria.
It was a dream initially, but now it's a reality, and we have 13 international qualified RBF-TA in the country. These people will not only support the project, NSHIP, but beyond NSHIP, all RBF-TA program in the country, we will call upon them every time, every minute. Because the process that brought them on board, from the beginning to the end, it's all based on merit. And we are very happy that we can proudly say we have international RBF-TA in Nigeria. I want to congratulate you all. I want to appreciate you.
In case you didn't know, the World Health Organization support for health systems financing shows how important it is, and in its World Health Report of 2010 described health systems financing as the pathway to universal health coverage. Little wonder why the National Primary Healthcare Development Agency, under the leadership of Dr. Faisal Shuaib, is graduating indigenous result-based fellows in health financing. In case you didn't know, health financing promotes raising funds for health, reducing financial barriers, among other reasons. Stakeholders hope that these indigenous technical assistants graduated will enhance and increase capacity in health financing going forward, causing a positive contribution to the primary health care system in Nigeria and the health sector as a whole. Toyin Ajolore, On Duty TV, Abuja, Nigeria.